think human innovation is going, along with AI, of course, is going to help healthcare a lot. And how does Exon Care address these challenges to ensure efficient and reliable emergency care?
First of all, Axon care is in a way agnostic to what kind of care it is, whether it's gynecology or what is. But as a choice to start with, we are staying away from emergency care. Emergency care usually needs a lot more intervention at the hospital end. While Axon care is actually trying to solve the problem of chronic diseases first, because it's a much wider challenge, which usually needs a lot more, it's possible today. But as I said, we are not restricting ourselves to multi-specialty care. We are also looking at how AI and other tools can be developed that can be given to the emergency medicine space. Or for that matter, how can we identify the red flags whereby we can pass someone very quickly to emergency medicine. So whilst we don't do emergency medicine ourselves, we are almost at the forefront of saying our health ATM will be the one place where we will tell you how dangerous your condition is or otherwise. And we will not only tell you, we will also arrange your care. So think about this scenario so that you can visualize this. Let's assume the same 19-year-old man went to my village ATM on day one, and the local doctor gave him the medicine. The day one does not change. But the next day, my man went to the ATM, and at the ATM, we just put an ultrasound scanner on his tummy. And my sonographer sitting in Sassoon Hospital can look at it and say, oh, this is perforated appendix. He needs to be brought ASAP. And now over that ATM, I tell the local doctor to say, please give him intravenous cefuroxime and metronidazole, give him some painkillers, give him some IV paracetamol, and I'm sending an ambulance to your ATM in the next 20 minutes. Just make the young man sit in it. 4 hours later, I would have operated on this patient, and the next morning, the patient would have actually been on his way to recovery. That is what Axon Care will be doing. Axon Care will be picking up early signals where emergency is imminent and preventing the life-saving catastrophes. I won't be able to do it for everything, but we'll be able to do it in a lot of areas. So let's assume, I'll give you another simple example. Let's assume you get chest pain. 80% of people who have chest pain are just having some kind of gastric issues. It's not really heart attack. But
Right.
if you come to my ATM and I do your troponin T there and then,
Yeah.
I do your ECG, and both are normal. Now I know the chances of this is not hard. I merely say, don't go to the hospital. After an hour, said stay here. An hour later, I'll repeat your troponin. I'll recheck. On the other hand, what have I done? People with the real problem, I've created capacity for them in the hospital. So anyone
Right.
who's reaching the hospital now has a bed available. His life will get saved. So you have to look at this from multiple dimensions. And yes, Axon Care is, that is our ethos. Like I said, that's our soul. We are here to help human beings. We will integrate and think outside the box and help whoever is looking for help.
Right. So, Exon Care is going to be crucial in not only understanding the emergencies, but also differentiating whether this is actually a healthcare emergency or not. So, that way, we are also saving a lot of accommodation issues in the hospital, and the actual healthcare emergencies are the ones which are going to go to the emergency units.
Absolutely. I'll just change one word. So not just Axon Care. There are a lot of people with the same initiatives which will be complementary to what we do. And we all should be at the center. Whether we will be or not, only time will tell. But we should be at the center of transformation of healthcare in a positive way. Like I said, if I can diagnose a brain tumor early, if I can pick up someone's health condition early in pregnancy, if I can diagnose a child much before he gets unwell due to, let's say, a hematology problem, all these are real things. And I don't see Axon Care as the only solution. Axon Care is one of the platforms which will allow a lot of innovation to make the transformation.
Right. So, how will AI evolve to handle unforeseen large scale health crises like pandemics, like the one which we saw in 2019? What role will Exon Care, along with other AI entities, play in this scenario?
I'll give you a very interesting real world example. When the COVID pandemic started, do you know what which was the most reliable tool to pick up where the pandemic was spreading? Google search. And do you know, if we people were searching for paracetamol and fever, and if we looked at where were the searches happening the most, you could identify where the fever was happening, and you knew the pandemic. So that was a very crude way, but it actually is a very interesting way. Now let me just put it in this way. Let's assume I've got a global network of health ATMs. Now, on an average day, I am expecting 3 people with fever. Suddenly, on one day, I'm getting 7, 8 people with fever. All I have to do is find out how many other ATMs in my local area are seeing extra people. And I will straight away alert the WHO to say, listen, this cluster is showing an unnecessary prevalence of fever. You need to send your epidemiology team because we need to isolate this area. Now, what will happen is, if I can control the pandemic before the geographic spread, human to human spread is possible, you will prevent global catastrophes. The real reason pandemic spreads is because you don't pick it up very late, till very late. So don't think about a pandemic as an inevitability. Pandemic is not inevitable. You just have to pick rapidly spreadable conditions, and you need to have the insight and the data to pick it up. As I said, fever is one indicator. Vomiting is another. Diarrhea is the third. But these are known as communicable diseases, right? A lot of these are spread from human to human. You have to put, okay, now over the last year, this population shows you an average incidence of this problem these many times a day or these many times a week. Now all I'll do is monitor it. If that number starts moving upward in cohesion with the other ATMs in that area, then I know something is happening here. I can isolate that area so fast. I don't need to have a global declaration of pandemic. I can actually say, okay, listen, you will never have a pandemic with this kind of a thought. You just have to be smart. You have to work with people, and you have to globalize this. If it is possible that people won't like this idea because there are business interests beyond medicine that people have. But if you're genuinely looking for solutions, you have to think outside the box. You cannot say, okay, I'll wait for a pandemic and then AI will help me solve it. No, you cannot afford to have a pandemic.
Right.
You get the point?
So, yes, this perspective is quite interesting. Having that perspective in my mind now, it's quite a different way to look at it. So, this was a time today on MedTech Talk. It was great to engage in conversation about healthcare emergencies with you, Doctor.
Thank you
So,
so much.
thank
My pleasure.
yes. So, for our viewers, subscribe for more insights into the world of medical tech today and tomorrow. Thank you.